Hello, everybody. I'm Dr. Dean Howell from CODS. And what we're going to talk about is what's wrong with medicine today. So, what is mainstream medicine offering nowadays? Allopathic treatment. That means symptom-oriented treatment. Now, if your pill worked for the day, when you wake up the next morning and you still have the pain and you take the medicine again, that is the medicine of widespread, what we could call traditional medicine now. What's the difference between that and the approach that I'm talking about? I'm saying we will help you treat the cause as to why you have those problems. So we can treat the problem as a simple symptom, simple-minded therapy for a simple-minded approach, or we can do the more complex, less immediately rewarding approach and start treating the problem itself. And that's what we do with our hands-on approaches, with our changes in diet and lifestyle, and the various supportive therapies that we will need to do as you transition from your current state to a state of theoretically ideal health. So I got to a point where I didn't think anything of the approach that the doctors I was being brought to, I thought nothing of their approach. I didn't respect it. Well, the reason I had no respect is because it didn't work. So if you want results, you've got to treat the cause. That's what I found out with my life. So what are you going to hear? So what you're going to hear is going to be how your body actually works instead of the way that it's characterized in the popular media. So there's a problem with what medical practitioners are offering people now, because it's not treating the cause, it's treating the symptoms. It's trying to figure out how you can continue with the problems that have created your complaints. You can keep living that way and take magic potions that will help you temporarily be better. Our whole way of life evolves around our diet and social habits. And the carbohydrates are what create propensity towards cancer, diabetes, and heart disease. So what we're really doing that's different is what I've just been explaining. We need to figure out your causes. And a lot of them are diet and lifestyle and chemical exposures. But the other parts can be the traumas that have affected your structural body. Now, yes, if you get punched in the face and your nose is crooked, that's an obvious trauma event. But if you were raised in a way that you were humiliated or belittled all the time, that also can create damage that can be ended up being embedded in your structure. So those things and the chronic infections, treating those, you're never going to be able to heal. And because you're never going to be able to heal, you're going to keep having to treat your symptoms. If you start working with us, it's sort of like peeling an onion. We have to take off layers of junk as your mind is freed up of all these bad chemicals, as your mind starts working better, as the brain is housed in the skull, and as we start correcting skull imbalances, we change the functional shape of your brain, so we change the fluid flow patterns in your brain. As we optimize that, your brain will work better. So all of these things that we try to plan in for you when you come in to see us is all designed to make you your ideal self. Doesn't that sound good? Come and talk with me. Thanks.